Welcome to Trauma Tea and Tangents, the podcast for those of you who feel like you've never fully been seen, for those whose experiences seem to be chronically invalidated, and for those who have been told they are too much and not enough all at the same time. I'm Hannah Guy, a trauma therapist and the owner of Revive Therapy Services based out of Philadelphia. And this podcast is all about the messy, complicated, and very real parts of being human. Mental health, relationships, trauma, healing, and honestly, just basic life shit. You name it, and we will probably talk about it here. Just a little disclaimer for you. This is not therapy. Nobody's going to make you do a body scan or talk about your triggers. Unless you really want to, then go off, queen. And with all of that being said, let's get into it. Hello, everyone. Welcome back to Trauma Tea and Tangents. I am here today with the lovely Kamber Peerboom, LICSW.
We have to be different in Minnesota. Throw a little I in there for some reason.
Yep. And she is a therapist. She has her own practice called Loud Thoughts Therapy. She primarily was telling me she does a lot of coaching now as well. But today, we wanted to talk a little bit about what it means to be authentic as a therapist, especially in 2026 with like social media and everything. So
100%. Oh my gosh. I am so happy to be here. Thank you for having me. And thank you for letting me talk about this topic that I talk about like incessantly on the internet. And so it's fun to have like another space to talk about it. And I think it's just such an important piece of the conversation because it's challenging so much of what we learned of like who we're supposed to be and what we're supposed to be as therapists. And, you know, we'll get way more into it. But like what I have found is that my client retention is like through the roof. We are able to make like, because we're able to like connect in such a deeper way because it's so much more human. It's so much more human if we just show up as ourselves and actually be authentic as therapists and aren't just like modality robots that grad school like forces us to be all the time. I can't stand it.
Yeah, and I think a lot of times in grad school, they really are trying to teach you like foundational
Totally
skills that you need that baseline so you can then make the decision of what that looks like to show up authentically as a therapist. But I do think it's limiting in the fact that we can be put into a box of how we're supposed to talk, what we're supposed to wear. Don't disclose anything personal. And I'm like, I think I personally, that's a struggle of mine. Like I overshare and I see on these Facebook group, like therapist groups where people are like,
groups.
oh my God. People be like, yeah, do you guys think it's okay if I disclose this like minor thing about myself 3 sessions from now? And I'm just like, oh shit, we're like debating this. I would have shared that.
I would have 100 like, oh my gosh, my client's gonna freak out because they know that I'm going on vacation next week. Like, no, that's insane. What do you mean? They can't know anything about who I am as a person. How are they supposed to open up if they don't know like who I am, if they can trust me, if I'm like an actual real human being? That's just, it's baffling to me. And like you said, I think that like, you know, some grad school programs are better than others, but like a lot of it is foundational. You know, we have to know where we start and like, but then I think what I think a lot of grad schools do poorly is that they don't tell you what's next, you know? They kind of like keep you at that foundational level. And it's like, this is the one way to be a therapist. And it's like, no, there's actually 8 gajillion ways to be a good and ethical therapist. It doesn't just have to be, you know, show up, do CBT, don't show any emotion and go home. Like I promise you don't have to be that.
Right. I remember the first time I ever went to therapy, I was about 16, I think. And I just remember being so uncomfortable. And I asked my therapist, just like, oh, do you have kids? Like, do you have a family? Because like, I'm uncomfortable. And she deflected the question and was like, I'm not telling you that. That's how I perceived it as a 16-year-old. She probably said it more professionally. But to me, it came off as cold. And I'm like, I'm supposed to tell you my personal life and you're not even going to share anything. And for some people, that's fine. For me, I only saw that therapist like 2 more times after that because I'm like, I don't feel comfortable with you.
100%. Well, and I think that's a good point too of like for some people that's fine because people when I talk about this on the internet like yell at me all the time of like this is unethical. You can't do this. You can't like be loud or obnoxious or all this stuff. Laugh. God forbid we have a little bit of fun. I'm like I am not asking you to be me as a therapist. I'm
Right.
asking you to be you. And if you are like if in your core you are like a blank slate, closed off kind of therapist, like there's people who will resonate with that. There's people
Yes.
people need that too. That's just
Yeah.
not who I am. And I'm not going to be effective as a therapist if I try to show up as who you are, just like you're not going to be effective as a therapist if you
Right.
try to show up how I am.
Right. And I think it's about finding the therapist that works best with you, that makes you feel like you can be as open and honest and vulnerable as you possibly
Completely.
can be. And yeah, for some people it is, I just want a blank slate and I don't want to know anything about you.
A
Um,
100%. Yep.
and I'm kind of like, I'm not your girl.
Yes. And I say all the time, I would rather be 1,000 times more effective to the people who are my people than a little bit effective for everybody. Like that would be my nightmare to be a little bit of effective for
Yeah.
everybody. Because again, there's somebody for everybody. And if I'm not for you as a therapist, I'm like I am not offended. That's usually one of the first things I say actually in my intake session is like, we'll get through this. And at the end of this, if you're like, hey, you're not my vibe, tell me because I probably know somebody who is your vibe and I would rather send you that way than for you to
Yeah.
just sit here and be uncomfortable and waste your time, waste your money, waste your insurance. Like, I don't want you to do that. This is a lot of work and I want you to get the most out of it. And if it's not me, again, I'm not offended by that whatsoever. Please just tell me.
Yeah. I will say that during intakes as well, of just, I want what's best for you. And
Yes.
what's best for you is actually best for me too, because I want to also connect and enjoy the
Correct.
work I do too. And I've actually gotten flack from people about saying things like this on TikTok or like Instagram
Mhm.
or something of, um, like I don't enjoy working with people who are actively struggling with addiction,
Yep.
right?
Hmm.
And
Yep.
I've had people comment, they're like, "You can't tell your opinion about that. Like, that's mean. Like, that's not holding space." And I'm just like, "Okay, like, don't."
Correct. Well, again, like, hello, we are humans. We are human beings. This is our professional career. Yes. And we get to have preferences. And again, like, you don't want me to be a therapist for somebody who is experiencing active addiction, for example. Like, that's not the population I work with. Why
No,
would you want
because
to work with me if that's not something that is not at the top of my skill set? Could I do it? Yeah. Is it going to be beneficial for anybody? I don't really think
it
so.
might be a little beneficial, but I find when I'm more energized about something and I'm passionate about something, I am able to show up 100% more
Totally.
than I am when it's, you know, obligatory.
Totally. Well, and at this point in my career too, I'm very picky about the clients I will see. I'm very picky with my schedule. I don't see a ton of clients anymore because, like you said at the beginning, I do a lot of like consulting and coaching. And so the clients that I'm going to see, again, like they're the ones who we are going to be a great fit. And again, that they're energizing me. I'm not doing anything at this point that contributes to my burnout. I refuse to keep playing the burnout game. And again, the clients on our caseload can be a part of that for sure. And again, there is somebody for everybody, just to be clear. There is a therapist for everybody. But what I work with at this point is pretty specific, pretty boiled down. And those are the clients that I'm going to, again, seek out and work to
Yeah.
attract and want to work with.
And I mean, I think there also are limitations to it
Mm,
too. I've had
totally.
experiences where, for one reason or other, professional client relationships have ended because I'm showing up as myself. I love people and I'm very friendly and amicable, and I'm very good at validating feelings and holding space and really
Yep.
making people feel seen. And when I
Mhm.
do that, it's authentic to me. But I'm
Yes.
also running a business.
100%. Yep.
We're going to talk about this in another episode, but running a business, you have to have certain policies and procedures.
Yes.
I've
Yep.
had people, kind of, let's just say someone no shows,
Yep.
right? And then they got mad that I didn't text them
Yeah.
or I didn't. And I do text clients. Like I know
Right.
again, coming back to the authenticity as a therapist,
Hmm.
some therapists are like, nope, you don't get my number at all. You can email me. And I'm like, I don't really care. Here's my personal number.
Hmm.
And that's
Yep.
just what I'm comfortable with.
Totally. Yep.
I'm comfortable with all the clients in my practice, I have a couple of therapists that work under me.
Sure.
I'm going to be comfortable for them to all have my number. But
Right.
sometimes
Yep.
I work, but they're like, well, why didn't you text me? And I'm like, it's this is awkward now, but I
Mhm.
have to also, this is a way I make a living. And
Right.
part of therapy is you being accountable and showing up,
100%. Yep.
right? Like it's your responsibility to show up for your doctor's appointment. It's
Yep.
yours. And you get
Mhm.
reminders, like you're getting email and text
Yeah.
reminders too.
Yep. Yep.
And so I've had a client terminate because of that. And it was hard because like I really enjoyed working with her too.
Yep.
And I always try to repair of just like, hey, I understand why that's frustrating, 100%. And here's where we're at with this. I would love to meet again and we can like try to repair this.
100%.
And they're just like, no, not doing it. And I'm like, okay. And then I have to sit with that.
Yes, yes. Well, and it's so difficult. And actually, I love that you brought that up because, like, to me, like, this is like such a therapeutic experience. Like, especially with like, again, a lot of the clients that I work with, I am typically a borderline specialist. I've moved a little bit away from that, but like, this is like a prime example of like, okay, we have a rupture and repair process that we can play out in real time of like how you would tend to respond, which is maybe ghosting me and never seeing me again. And if that's what you're doing at this point, again, we're not ready, and that's okay. That's okay. But when you have the ones who are able to kind of like rupture and repair through that and work through the boundaries, the feelings, the distress tolerance, all of the shit that goes into all of that, that's actually one of my favorites. I love when we're able to rupture and repair in kind of a
Yep.
controlled manner, so
Yeah.
to speak. And I have a lot to say about the whole balancing the policy side of things with all this stuff, but I can save that for the episode where we talk about business
Yeah.
stuff.
Yeah. So for people who don't know what we're talking about when we are saying rupture and repair, I mean, it's kind of in the words, right? But like how would you define rupture and then how would you define repair and why is that therapeutic?
Yes. So rupture means that like something happens in a exchange or in a relationship that creates conflict or creates turmoil or something like that. And then repair is how we resolve or move past that. And so a lot of times where this is therapeutic is because this is where our trauma responses come up, is when we're rupturing. And if we have some sort of an emotional response, a lot of times that is valid. A lot of times that is maybe greater than what the situation might call for, or we have an emotional response and then we jump to like an action that is harming ourselves or others, then again, most of the time that is the trauma response. Or if trauma feels too daunting of a word, it is like based in something that you have previously experienced. And so now your nervous system automatically associates that with being unsafe. And so you jump to these different responses.
Right.
So in therapy, what we want to do is we want to figure out, one, okay, how do we de-escalate during the rupture kind of long term? But two, how do we repair in a way that we can actually move forward in this relationship?
Yes.
Because again, a lot of times, a lot of people will just ghost or avoid or never show up again or
Yes.
whatever it might be. And, again, sometimes boundaries like that are appropriate. Sometimes, again, because of our past experiences, we are, again, using or having an action like ghosting that is actually probably not helpful and, in fact, could be harmful in this case to the client because then they'll repeat the pattern or whatever it might be.
Yes. Yeah. No, I think, and showing up as who you are authentically as a therapist is part of that repair.
100%. Yep.
I don't know about you, but I can tell when someone's being inauthentic and it's bullshit.
Yes, that like not just clients, but like in life, that makes my skin crawl of, oh, you are just not showing up as yourself right now. And I don't understand. And it's obvious.
Or it's you're saying what you think I want to hear, and I can tell you're not being genuine, and there's something there. And so work a lot with complex PTSD and people with CPTSD. There's a lot of hypervigilance,
Yep.
especially when it comes to relationships.
Mm-hmm.
And I would say I fall under the CPTSD category as well.
Mm-hmm.
And I am very hypervigilant and hyper attuned and hyper aware to people's affect, how they're carrying themselves. I can tell when something's off.
Mm-hmm.
And so I also can feel when someone is genuinely being empathetic and compassionate and wanting to repair versus they're just going through a script of what they're supposed to say to repair.
Totally. Yes. Yes. Or like you said, like what you think I want to hear, or you're again, like going through this process, not for yourself or for, your own growth or your own values or whatever it might be. You're doing this because of me or because of some other person. And again, the problem with that is, again, it's another form of repair in a way that's actually like, it's based in usually trauma response and is probably
Yeah.
harmful for you in some way or another.
Yeah. It also makes the repair so much more therapeutic
Yes. Yep.
because you actually have a connection and a relationship with your therapist. And I'll use myself for example.
Hmm.
So my current therapist, I don't mind calling my therapist, my personal therapist, out on what I'm feeling. And so I noticed when I would talk about a certain thing, she would like respond. She would have this facial
Mm,
response.
yeah.
And I paused during what I was saying and I was like, I don't like that you just made that.
Uh-huh. Yep.
I'm a little too like, yeah, I don't like that.
Uh-huh.
As and I was able to explain it to her. I'm like, I feel like I already naturally am inclined to care about what everyone else thinks about me and need everyone else's input to make decisions for myself. And I'm trying
Totally.
not to do that. And
Yep.
when you made that facial response, it made me feel like I'm doing something bad.
100% it brought that up in you. And good for you for calling it out in session because I'm somebody I always describe myself as like a direct therapist. Like I'm gonna go right at you in a nice,
Yeah.
loving, kind way. I'm not like being an asshole. But I appreciate when clients do it back to me. Like I don't want you to just sit here and like, if I'm challenging you and it's not sitting right with you, or you think I'm off base or whatever, again, like human, I'm telling you what I think. If you disagree, let me know. And then we can figure out like, okay, what's actually happening here? Like
Right.
that's, I think, such a huge
Right.
part of, again, like myself as an authentic therapist and the style that works for me and the clients that I see.
I always get really proud of my clients when they call me out on my shit. Or like they'll be like, hey, when you said that, that felt really minimizing and invalidating.
Yes.
And
Yes.
I'm
Cause
just like, I am so happy you brought this up. I am so proud of you. I do not take it personally
no,
whatsoever.
no, not at all. Not at all. I love when clients, one, like advocate for themselves, like, hello,
Yeah.
perfect, fantastic, thank you. And again, because some people are really great at it. Sometimes we're too far on the other end and you're being aggressive and rude, and that's a different conversation. But
Yeah.
like when
Yeah.
you're able to like, again, just assertively communicate like what happened or something that I said or misspoke or whatever. I call myself an inarticulate therapist because a lot of times the words that come perfect or pretty or not like
Basic
exactly what I
instinct.
want them to be. And so I flub over my words all of the time. And if
Yeah.
I say something that is not helpful, that was difficult, that was hard to hear, or just like, again, we weren't ready for it, I want to be able to have that conversation. I think that is so, so important. And again, it goes right back to like another example of like what rupture and repair looks like in the therapeutic process.
Right. I also think with social media, there's more visibility as therapists
Yes. Yep.
where people can actually see who you
Mm,
are as a person.
a
And
100%.
I remember being in grad school and then being like, make sure you put a different name on your Facebook so clients can find you.
Right. Yep.
It's like, no, they can find you.
Yes.
Very easy to find you. I also think I have a social media presence because of the business side of things, right? And I find that being who I authentically am, that's what works for me.
100%. No, I completely agree. Yep.
Yeah.
Mhm. My theory for like how I present as a therapist, which is just like authentic, is also my theory for how I present as a therapist on social media. Because again, like a lot of times you go to Psychology Today, if you're a client looking for a therapist, you weed through 8 million people's whatever picture perfect profiles. But then it's like, who is this person? And I think social media gives people the opportunity to, again, actually like assess if a therapist might be a good fit for them or not before
Yeah.
having to commit like however much money or like show up to 8 million different like 15-minute intake sessions. It really can be a valuable tool in the like therapy shopping process. And I think a lot of therapists, I'll say, that maybe are hesitant to post on social media or think that there's problems with posting on social media, which there can be, don't get me wrong, there can be, but like I think that, again, it's just like, it's part of the reality of our world these days, and if we, pretend it doesn't exist, to me, that's when there's so much more opportunity for harm.
Yes. Yeah. 100% agree. We were talking about something before we started recording. Did you remember?
I'm sure I was. I don't remember.
And I literally interrupted you and was like, "Wait, hold that for
I
what we're gonna be
I
be."
literally remember this happening. I remember. I think it was just a little bit about like how we were able to find community of people that like
Yes.
thought like us or experienced or practiced like us on social, like a community of therapists on social media, and how
Yeah.
I personally, I have wonderful therapist besties. Like I've met really great people in real life, but for a long time, especially early in my career, like I struggled to find kind of like my community, my people amongst the therapist community, just like in my places, like where I was working at, because again, like people were practicing in a way that just did not resonate with like who I was. And I was just like thinking that I was wrong or a bad therapist all the time. Again, when I was a baby therapist, because again, I was just like, I don't know if I can do this. If this is what being a therapist looks like, I don't know if I can do this. Yeah. So social media for me has just been an incredible place to find a community of therapists who, again, just value this authenticity part of the therapeutic relationship, and not only value it, but see it as like crucial, in my opinion, like necessary.
Yeah. It's like a non-negotiable for me.
Yes. Yeah.
When I emailed you to ask you what topics would you like to talk about for the episode, and you mentioned authenticity as a therapist, and in my head, I'm like, well, duh. Like, doesn't everyone do that? And then I'm like, oh, actually, no.
No.
That's how I show up in my life professionally and personally.
Yep.
And I have a hard time understanding how one can just completely just shut down.
Mhm.
And to your point, when I was a baby therapist, I remember doing like a supervision group or whatever, being a part of a supervision group. And someone brought up the concept of telling a client they were proud of them. Like, I'm so proud of you. And I remember everyone being like, no, you do not do that. I mean, so granted, it was based out of psychoanalysis, which is very,
Sure, sure, sure.
which for people who don't know, psychoanalysis is very like client led. Like the therapist really doesn't say anything and doesn't disclose anything. They kind of just ask
Hmm.
little questions here and there to get them to understand their childhood and like whatever. And so I just remember being like, what do you mean? And they explained it. And the way they explained it made sense. It was kind of like, well, then you're creating a standard where they need to impress you and make you proud. And I'm like, totally get that.
Hmm.
And I have a ton of clients who have a really hard time being proud of themselves.
Yep.
And so I'm going to be like, hey, I see that you showed up in this way that was different than the last time
Yep.
it happened. And
Hmm.
I'm really proud of you. And you should be proud of yourself too. And if you can't be proud of yourself, I will hold that for you.
100%. Well, and that's exactly what I was going to say is I do, again, get the psychoanalytic
Yeah.
side of it. But to me, I'm like, me validating somebody who's been chronically invalidated their entire life is actually so much more therapeutically challenging and so necessary. Like that, me telling somebody that they're proud of them, again, a lot of times it's not that it's, I'm not saying that just willy-nilly, I'm saying that because it is something that is actually valuable to their therapeutic journey, their trauma, their experience, all of that kind of stuff. And so again, it's to me, when you said that, like when you said nobody said, or like, hell no, you can't say that you're proud of them. There's so many examples off the top of my head where I would find that to be more therapeutic than not. Like
Yes. Yes.
100%.
Well, when it comes to therapy too, the change that people are making in their life is often more subtle and it's not as concrete. It's not like,
Yes.
I hate using this example, but this is the one that can, it's not like losing weight where you can concretely use data of like, I was this weight
Right.
and I am
Yep.
now this weight.
Mm-hmm.
It's subjective. And a
100%.
lot of
Yep.
people, especially at the beginning, are not going to notice the changes that you're making.
Mm-hmm.
And
100%.
so it can be really hard to continue to show up and try to change the way you're seeing yourself, the way you're thinking, when you're not getting any external reinforcement that it's
Yep.
working.
And yes. Yep. You have to really, again, like, trust yourself that like what you're doing and how you're showing up and being consistent is leading towards something. And again, like you said, it's not like a point on a map. You can't just be like, this is where I'm going and this is, I'm going to be healed and perfect by the time I get here. Like it's a totally different, like you said, like subtle, subjective kind of experience. And kind of in the same vein, something that I tell people all the time is that as a therapist and as a client, like a lot of sessions are mid, not every session is a banger. Not every session you're having like this huge breakthrough, that's not how this work works. Again, like you said, it's subtle. There's pieces, we uncover little bits at a time. And then we usually lead to like some sort of breakthrough or some sort of realization or something like that feels, a little bit more like, woohoo, look at this thing that we realized or accomplished or did or changed our lives or whatever it might be. But again, most of the time, most sessions are a little bit middle of the row. And that's just kind of how life is, Not everything is amazing. Some sessions are going to be really tough or bad even. Most of them are going to be somewhere in the middle. But again, I go back to authenticity. As long as you feel like you are having some sort of like human connection with your therapist, are going in some sort of direction, right? You're not just sitting here yapping every single week, about nothing. You will happen upon all of the shit that is uncovered that you, again, are subtly looking to make changes in your life.
100% agree. It is very mid.
It is
just kind of like everything is mid.
Yeah.
Like working out is mid.
Yep.
Like you're not going to see all these gains that you want. It's just like, okay, showing up and trusting the process. It's a lot of process.
It's a lot. Oh, I hate it and I love it. It's true. It's a lot of faith in the process. Yep.
We need to wrap up. Is there any other things that come to mind that you wanted to share, speak on when it comes to this concept of authenticity as a therapist?
I mean, I feel like I could talk about this forever, especially with you. But I think just overall, if you're a therapist and feeling like pressured to show up in a certain way, or grad school is telling you that you have to be this kind of therapist, or you're not allowed to have emotions, or you're not allowed to be any sort of thing, I just want to tell you that is incorrect. You can be anything that you want to be as a therapist. Again, as long as you're being ethical, but again, swearing in session, not unethical. Not being a blank slate, not unethical. You can be exactly who you are as a therapist. I promise that you, one, will feel so much better about the work, and two, you'll be amazed. You'll be amazed what happens to your client relationships when you show up as yourself. And so my second or inverse point to that is if you are a client and just not feeling super connected to a therapist, or, just are feeling like you need a little bit more of that humanity side of things, just know that there are therapists out there who prioritize that. And again, you're push shopping, and I know we hate that and it sucks, but there are therapists out there who do prioritize that. And like I said at the beginning, though, there's somebody for everybody. There is a therapist for everybody. There's a therapist who's going to match your style or push you in the ways that you need, or that make you feel safe, make you feel comfortable. And again, authenticity isn't everybody being me, it's everybody being themselves. And there is somebody out there for you to connect with. I promise.
Yeah. Kamber, thanks so much for coming on.
Yes, this was such a joy. Anytime. Thank you for having me.
Love it. And so I'm going to link Kamber's info in our description if you want to know more about her, if you have questions, if you want to work with her. That's how you can find her.
Perfect. Thank you so much.
Of course. I will see everyone next week. And I hope everyone has a great week next week. Thanks for hanging out with me on Trauma Tea and Tangents. If something here made you laugh, cry, or feel a little bit more seen, then my job here is done. Remember, this isn't therapy, but if you are curious about the real thing, you can check out my practice, Revive Therapy Services. And if you are wanting more tangents, tea, and truth bombs, make sure to follow, subscribe, or share this with someone who just gets it. Until next time, take care of your nervous system, drink some water, and please stop trying to diagnose your ex.